Okay, audio 3 of lecture 1, and this should be it. So we ended talking about oxygen saturation and how we'll avoid diffusion hypoxia with 5 minutes of postoperative oxygen after nitrous oxide delivery. So when are we going to use nitrous? Obviously managing fear, anxiety. It's great for gaggers prior to local anesthesia injection. Stress reduction for medically compromised patients. You can go ahead and read those indications for use. Let's spend some time wrapping things up with how nitrous oxide affects various body systems. The easiest thing to say for the cardiovascular system is it doesn't do anything. It has no negative effects. In fact, it may have some positive effects, right? It decreases anxiety, increasing the patient's pain threshold, provides more oxygen than air, 30% delivery instead of the 21% we're getting in atmospheric air. You will be taking a preoperative or a pre-sedation and a post-sedation blood pressure and pulse for your classmates, for your patients. You may notice a decrease in blood pressure and a decrease in heart rate. This is likely due to a relaxation effect. It's not a direct effect of the drug on the cardiovascular system. So there are no negative effects. There are no contraindications to the use of nitrous oxide with cardiovascular conditions. Respiratory system. The key question, can the patient breathe through their nose? If they're unable to breathe through their nose, sedation is going to be incomplete or inadequate. It's not going to work. Asthmatics can use nitrous oxide sedation. Nitrous oxide is non-irritating to respiratory mucosa. And again, it is stress reducing. Consultation with a patient's physician is needed if they have the respiratory conditions of emphysema, chronic bronchitis, any kind of middle ear disturbance, or recent ear, nose, or throat infections. Nitrous oxide sedation is contraindicated for patients with moderate to severe COPD, infectious diseases, think tuberculosis, pneumothorax. Pneumothorax is a collapsed lung. Again, active ear or throat infections, active sinus infection, patients with cystic fibrosis, or an individual with a nasal obstruction. It's fine to use in patients with hepatitis or jaundice, cirrhosis, any liver or kidney conditions, because nitrous is not metabolized in the liver. It is not excreted by the kidney. You do know that nitrous depresses the central nervous system. We're not really sure how. Scientists are not really sure how. Memory is affected to a minimal degree. Nitrous oxide is a relative amnesic. Patient's ability to concentrate is diminished, but no concern for a patient with seizure disorders, Parkinson's, someone who has had a stroke, no concern. No problem for individuals with blood disorders. There has never been a reported allergy to nitrous oxide. Patients who are diabetics can use nitrous oxide. Cancer patients can use nitrous oxide, except cancer patients undergoing treatment with a drug called bleomycin sulfate. Bleomycin sulfate is a cancer agent, a chemotherapeutic agent provided to patients with lymphoma, testicular cancer, or squamous cell carcinoma. If a patient is treated with bleomycin sulfate, they cannot have nitrous oxide sedation. Nitrous oxide does not interact with other drugs, but it may be synergistic with other sedatives. So if patients on other sedative drugs, this will not interact with it, but it may enhance a patient's sedative that they're currently taking. Absolutely, you cannot use nitrous oxide in a patient who has had a recent ophthalmic surgery using an intraocular gas. The patients will know who they are, but confirm they have not had an eye surgery in the last 3 months, that they used an intraocular gas. Again, pneumothorax, collapsed lung, nope. Bowel obstruction, no, absolutely not. Tympanoplasty graft, a middle ear graft, no, you cannot use nitrous oxide. So these bowel obstructions, middle ear graft, think of a sinus infection. It is a gas, and the gas has to go somewhere. If we have these obstructed spaces, if patients have these obstructed spaces, obstructed bowels, obstructed nose, obstructed sinus, obstructed ear, administering nitrous oxide would create pain in these areas. Because the gas has to go somewhere and we'd be pushing against those obstructions. That's why those are contraindicated. We have relative contraindications. In other words, you must take these on a case-by-case basis. A compulsive personality, a patient that's claustrophobic. Having the nasal hood on a claustrophobic patient can certainly exacerbate their claustrophobia. If you can get a claustrophobic patient to keep the nasal hood on long enough for 3 to 5 minutes, then you're home free. But keeping that nasal hood on for a true claustrophobic can be problematic. Again, somebody with a nasal obstruction or just won't breathe through their nose, it's not going to do anything for them. Someone who has pre-medicated themselves, pre-intoxicated themselves before they've come into the office. Alcohol, recreational drugs are CNS depressants. We don't want to exacerbate that with our nitrous oxide. Children with severe behavior problems. A child, as a hygienist, you are not able to administer nitrous oxide in anyone under the age of 18. Having said that, you are going to have questions on pediatric administration of nitrous oxide. A child has to be able to sit still and keep the nasal hood on. So a child who cannot sit still in the chair, not willing to keep the nasal hood on, it's not going to work. Autistic children, on a case-by-case basis, some will be fine, some not so much. So again, somebody, child or adult, who can't cooperate. We talked about the respiratory conditions, a collapsed lung or moderate to severe COPD. Pregnancy, especially in the first trimester, you need to get a physician's consent and go ahead and read this on yourself. Of course, patient refuses, you are not going to be doing it. Nitrous oxide oxygen has a long history of safety. It's used in the emergency department. I've already mentioned managing the pain of heart attack, as well as other medical specialties, non-dental specialties where it is used. 80% of the nitrous oxide gas manufactured is actually used in the medical field. Medicine uses it a lot. The dosage we use for minimal sedation, anxiolysis, 20 to 50%. Amnesia, we want to create some amnesia in our patients. You will not be able to deliver this dosage, but the dentist can. That's a 60% level. Unconsciousness, well over 80%. In fact, you can't get over 100% of nitrous oxide administration. It's not a general anesthetic. Again, current dental machines, what you're going to find in your dental office, won't allow anything less than 30% oxygen. all the benefits of nitrous oxide. Disadvantages, as written, um, minimal occupational hazard. We'll talk about that in a future lecture. I believe I've mentioned already, but you may administer nitrous oxide under direct supervision of a dentist on patients who are 18 years or older at a maximum of 50% nitrous oxide. Of course, you have the education as you are now, and you'll take the exam. I'd encourage you to sign up for the exam now. Sign up for it ASAP. Take it. You can take it when the course is done, and you'll have the material fresh in your mind. As far as dental assisting in Michigan, an RDH can assist and monitor with the administration that you or a dentist provides. That's an RDA only, a registered dental assistant only, with required education. They do get that at GRCC. Question that comes up, can an assistant adjust the level of sedation? In an emergency, yes, they can. They can turn off nitrous oxide and give 100% oxygen. Other than that, no. They are to assist and to monitor. They are not to deliver. That's it for Lecture 1. Let me know of any questions you have, and we will see you in the halls of school. Thanks. Bye-bye.